This video is going to demonstrate a hip release followed by active assisted range of motion to gain more mobility in the hip for the action of hip flexion. Pretty common to see like a jammed hip, and in a lot of people who have hip impingement, that's a big one right now, hip compression, or even some back pain, groin pain. One of the culprits is that the head of the femur, so if this fist is the head of the femur and this is the femur bone, the thigh bone, ideally it should sit into the socket centered. And a lot of times through our postural habits, the head of the femur is sitting in the front part of the capsule, which is the anterior capsule, and can be getting in the way as the hip moves into flexion. So it's not moving into the back capsule. With this motion, I'm going to get into the hip release first, just to open the hip sockets, followed by active assistive hip flexion exercise. Now, thing that I would really like to encourage when you do this is to make sure that you're using props so that initially your pelvis can stay neutral. So when you're lying down with the legs on a chair or a couch, the pelvis is in neutral when the pubic bone and the as-is marker, which is this bony marker on the ridge of the crest of the pelvis, are level. Now for me, I don't have a lot of mobility in my pelvis. So when I lay on my back, my pelvis tends to tilt. And so I have some restriction, some tightness. So I have to prop myself up with a yoga roll. Or you can also use a towel and use that to get yourself in neutral as well. When you use a prop, you'll probably need to prop up the upper back too. So what that means is when you lay down, you want to make sure that you don't have an arch in your back, that your ribs are more flush with your body wall. So I'll explain that more as I get into this position. I have my prop set up here, so I'm going to come lay down. So I have the yoga mat rolled up, and that allows my pubic bone and my as-is to be level. Because of that, I need to prop up my shoulders with another yoga mat, and then I have a block that my head can rest on. I'm not going to take the time here, but this is a good time. It's a constructive rest position to allow the hips to relax. It also allows decompression in the back. So take at least 1 minute. I would actually recommend 5 minutes of nice, quiet, rhythmic breathing, allowing yourself to relax first, and then going into the active assistive hip flexion. I'm going to go ahead and go into the active assistive motion, but do take some time to let down first. You're going to take a yoga strap or a belt or just something that you can use to pull and put it behind your knee. And I like to put it behind my knee and actually on this bone here, the tibia. So you're going to put that in the opposite hand. The same side hand is going to go to the groin line, and you're going to be giving a pressure downward. So you're going to press down into your hip as the other hand brings the leg up toward the chest, and then bring it back down. So you want to make sure that as you bring it up, you're not hiking up your hip. That's what we're trying to avoid. So when the hip gets jammed, we compensate with extra muscles. So we want to avoid that. Create space by distracting at the hip joint and then pulling up with the opposite hand. You can also pull up and hold it there. And keep inching it up as you pause to breathe. A lot of different ways to explore your hip mobility here, allowing allowing the hip to rest first, and then go into the active assistive. Try it.